This video reviews autologous blood transfusion using a chest drainage system at USA Health University Hospital.
Blood transfusion can be required after surgical intervention or for patients experiencing trauma to the heart or major blood vessels, causing severe bleeding into the chest wall. Primarily, this type of autotransfusion should be considered in those patients without absolute contraindications, such as blood that has been in contact with solutions that can cause hemolysis. Relative contraindications include gross contamination, malignancy, sickle cell, cesarean section, collagen or fibrin-based agents in contact with the shed blood. This procedure should be considered in those patients with greater than or equal to 300 milliliters of blood loss from the chest. Consideration should be taken to assess the patient's serum calcium level after large volume autotransfusion. Refer to the appropriate policy in PolicyStat located on the Employee Hub. This procedure requires an autotransfusion capable chest drainage system, which differs slightly from the system normally used at University Hospital. Differences include a vacuum indicator, suction monitor bellows, a suction port with a luer lock sample port used for installation in this procedure, and drainage tubing from the collection chamber. Additional equipment required for this procedure includes an IV pump, an IV blood tubing set, 500 milliliters to 1,000 milliliters of normal saline in a bag, sterile saline flushes to equal 100 milliliters, suction tubing, and reinfusion filter for salvaged blood. Procedure setup. Review provider order. Gather supplies. Correctly identify patient using 2 patient identifiers. Then set up the chest drainage system.
Remove the chest drain from the outer bag and perform hand hygiene. According to the manufacturer's recommendation, remove the blue wrap using sterile technique. Remove the chest drain from the box and rotate the swing out stand so it can stand on its own. Now we will fill the water seal. Remove the prepackaged 45 milliliter ampoule of sterile water from the back of the drain. Twist off the lid and squeeze the entire ampoule into the suction port located on top of the drain. This fills the water seal to the 2 centimeter line. When indicated by the practitioner, hook up the wall suction to the suction port of the chest drain. At the wall suction regulator, turn on suction and increase suction to at least negative 80 millimeters of mercury. You should see the orange suction monitor bellows expand beyond the triangle mark in the suction monitor window, indicating that suction is working. The chest drain's dry suction regulator is preset to negative 20 centimeters of water, although it can be adjusted from negative 10 to negative 40 using the rotary dial on the side of the drain. Do not adjust this regulator setting unless ordered by the practitioner.
After suction regulator setup and assessment, continue by clamping the tubing at the bottom of the collection chamber. Then clamp the drainage tubing leading to the collection chamber. Clean the luer lock sample port. Add 100 milliliters sterile saline to the collection chamber while holding the tubing up. Then prime the tubing at the bottom of the collection chamber to 50 milliliters. This step allows the tubing to be primed and ensures air is not in the tubing. This tubing will be connected to the filter and run through the IV pump to infuse the patient's blood to them IV. Follow University Hospital's medication administration procedure, including documentation, prior to inserting sodium citrate 4%, into the luer lock sample port leading to the collection chamber. While holding the tubing up, inject the appropriate amount of sodium citrate 4%. Unclamp the drainage tubing leading to the collection chamber. At this point, ensure the chest drainage is below the level of the chest. Connect the drainage tubing from the chest drainage to the patient's chest tube. For demonstration purposes for this video, the chest drain was not moved. Next, set up the blood transfusion filtered set with the bag of normal saline and prime the line. After, add the reinfusion filter to one side of the blood tubing. Then, prime the reinfusion filter using a back priming method from the normal saline bag, then clamp. Ensure to clamp the normal saline line above the filter. Set up the connection from the chest drain tubing to the blood transfusion set and filter. Clamp the blood tubing above the filter connected to the normal saline bag. Set the IV pump in basic infusion at a rate of 999, and the volume to be infused will be dictated by the provider's order. Prior to starting the infusion of the patient's blood back to them intravenously, the key guidelines for setup include: keep the chest drain below the level of the chest at all times. The IV pump needs to be about the level of the chest drain, and the blood tubing filter must be upright at all times, and make sure it's not kinked.